What is leukemia? When you have an increase in the quantity of white blood cells in your body, it can lead to leukemia, a blood cancer. The platelets and red blood cells your body needs to stay healthy are crowded out by those white blood cells. White blood cells, in excess, don't function properly. Symptoms of leukemia. Different issues might arise from different forms of leukemia. For many kinds, there may be no symptoms at all in the early stages. If you experience symptoms, they could be as follows. 1. Fatigue or weakness. 2. Easily bruised or bleeding. 3. Chills or fever. 4. Severe infections or recurring infections. 5. A soreness in your joints or bones. 6. Headaches. 7. Vomiting. 8. Convulsions. 9. Loss of weight. 10. Sweats at night. 11. Breathlessness. 12. Swollen organs such as the spleen or lymph nodes. Risk factors and causes of leukemia. Nobody is certain of the specific cause of leukemia. While some abnormal chromosomes are present in those who have it, the chromosomes do not cause leukemia. Leukemia cannot be prevented, although certain factors may set it off. You may be more vulnerable if you 1. Smoke. 2. Experience high levels of radiation, or specific chemical exposure. 3. Received chemotherapy, or radiation therapy for cancer. 4. Have a history of leukemia in your family. 5. Suffer from a hereditary condition such as Down syndrome. How does a person get leukemia? Blood is made up of 3 different types of cells: platelets, which aid in blood clotting, red blood cells, which deliver oxygen, and white blood cells, which fight infection. Your bone marrow produces billions of new blood cells every day, the majority of which are red blood cells. Your body produces more white blood cells than it needs when you have leukemia. The normal white blood cells that combat infection are not the same as these leukemia cells. Additionally, because they proliferate so much, they begin to alter the functionality of your organs. You might eventually run out of platelets to form clots in your blood, red blood cells to carry oxygen, or healthy white blood cells to combat infection. Classifications of leukemia. Leukemia is classified according to how quickly it progresses and changes, as well as the kind of blood cell that is affected. Acute and chronic leukemia are separated into different groups based on how quickly they develop. When the majority of the aberrant blood cells do not mature and are unable to perform the usual tasks, acute leukemia results. Things can quickly grow worse. When some cells are immature while others are normal, and able to function normally, chronic leukemia occurs. It worsens more gradually than acute variants. The 2 types of leukemia that make up the second group are lymphocytic and myelogenous leukemia. 1. Bone marrow cells that develop into lymphocytes, a type of white blood cell, are involved in lymphocytic or lymphoblastic leukemia. 2. The marrow cells that produce platelets, red blood cells, and other types of white blood cells are affected by myelogenous leukemia, also known as myeloid leukemia. Types of leukemia. Leukemia comes in 4 primary forms. 1. Or acute lymphocytic leukemia. This is the most prevalent type of leukemia among children. Your central nervous system and lymph nodes may get infected. 2. Acute myelogenous leukemia, AML. This is one of the most prevalent kinds of leukemia in adults and the second most common in children. 3. Chronic lymphocytic leukemia, CLL. The other most prevalent type of adult leukemia is this one. Certain types of CLL don't require therapy because they remain stable for years. Others, however, require medical attention because your body is unable to produce healthy red blood cells. 4. Myelogenous chronic leukemia, CML. It's possible that you won't have any symptoms with this form. It is possible that you won't be diagnosed with it until after a normal blood test. This kind is more common in those 65 years of age and older. Clinical diagnosis of leukemia. Your bone marrow or blood will need to be examined by your doctor to look for indications of leukemia. They may do the following tests. 1. Blood tests. A complete blood count, CBC, examines the quantity and quality of various blood cell types. A smear of blood searches for anomalous, or immature cells. 2. A biopsy of the bone marrow. Using a large needle, marrow is extracted from your pelvic bone for this test. It might inform your physician about the kind and severity of your leukemia. 3. Spinal tap. Your spinal cord fluid is involved in this. It might inform your physician if the leukemia has progressed. 4. Imaging test. Leukemia symptoms can be identified by tests such as PET, MRI, and CT scans. Treatment of leukemia. The type of leukemia you have, the extent of its spread, and your overall health will all affect the course of your therapy. The primary choices are: 1. Chemotherapy employs medications to eradicate cancer cells from your bone marrow and blood. The medication is available to you a. By injecting a shot into a muscle or vein. B. As a tablet. C. Into the liquid that surrounds your spinal nerve. 2. Radiation employs high-energy X-rays to either destroy or stop the growth of leukemia cells. It can spread throughout your body or only to an area where a high concentration of cancer cells is present. 3. Immunotherapy, or biologic therapy, aids in the detection and destruction of cancer cells by your immune system. Your body's natural defenses against leukemia can be strengthened by medications such as interleukins and interferon. 4. Targeted therapy blocks the genes or proteins that cancer cells require to proliferate by using medication. This treatment can either cut off the leukemia cell's blood supply, halt the signals that the cells utilize to grow and divide, or kill them to cells directly. 5. New blood-forming cells replace the leukemia cells in your bone marrow through a stem cell transplant. The new stem cells may come from a donor or from you, the patient. Your bone marrow will be treated with heavy doses of chemotherapy in order to eradicate the cancer cells. After that, an infusion into one of your veins will provide you with the new stem cells. They'll develop into fresh, wholesome blood cells. 6. Surgery. If your spleen is pressing on adjacent organs and is full of cancerous cells, your doctor may remove it. We refer to this procedure as a splenectomy. Please subscribe, share and like our YouTube channel and stay healthier every day.